Okay, good afternoon, everybody. I'll go ahead and call this meeting to order at 1 o'clock. And I'd like to establish a quorum today. Our first item on the agenda is to review the agenda. Is there any revisions or additions?
Madam Chair, I do have two additional announcements I would like to add under board discussion. The first being the Casper assessment coming up at the end of June, and the second is our reaccreditation announcement. Thank you.
Great. Anybody else? Okay. Hearing none, we will move on to the review of the minutes. So just take a moment and review the minutes from the April 25th board meeting, please. And then let me know if there's any corrections or additions. Anybody have anything they'd like to add or change? Okay. Then we can approve them as they're written and move into our action items. So the first is the recommended fiscal year 25 budget to the BOCC.
Thank you, Madam Chair, members of the board. On page 6 of your packet is a memo. That's where I will start with my presentation of the fiscal year 25 budget. So just as a reminder, you all looked at a preliminary budget back at your April board meeting. And so today the action is to recommend for approval to the Board of County Commission the fiscal year 25 budget. Additionally, wanted to make note that the Water Quality Protection District Board, they also voted at their April board meeting to recommend the water quality budget for approval. So that has happened as far as process and protocol is concerned. So that approval has gone through their board as well. The budget, the fiscal year 25 budget this year is presented to you in 3 distinct sections in order to make it more clear kind of what the goings on in the budget actually mean. So what you see in the packet represents our health mill, which includes foundational public health services and administrative support funded primarily by our property tax revenue that's dedicated to public health. We also have a specific budget section that outlines revenue and expenses associated with grants. In fiscal year 25, we will have we anticipate 18 grants, and that's one less grant than we had in fiscal year 24. That's a small change from what we had this year. And then the Water Quality Protection District is the third distinct section within the budget. And the district is funded by fee assessments on properties within the district boundaries. So they receive their own dedicated revenue for the work that they do within the district. Highlights regarding revenue for fiscal year 25. Again, all of our revenue includes property taxes, assessments, fees, fines, charges for services, and grants. And our total revenue for fiscal year 25 will be $6,515,120, which is just over $822,000 less than fiscal year 24. Our cash reserves in our health mill portion of the budget at the end of fiscal year 24, so June 30th would be the end of this fiscal year. We are anticipating or projecting our cash reserves at $882,506, which is essentially what we've done is we've built our reserves back up closer to that 90-day reserve that is best practice to have that cash reserve in case of emergencies. We do not anticipate needing to use any of these cash reserves in order to balance the budget for fiscal year 25. The Water Quality Protection District portion of the budget, they will be using cash reserves. They have anticipated revenue that will be less than their anticipated expenses. They have a very healthy cash reserve balance that goes way above that 90-day reserve. And so they have sufficient funds to fully fund their budget expenditures, tapping into those cash reserves. Their board has essentially given them direction to spend down their cash reserve to meet that 90-day reserve and put those funds into the work to accomplish their strategic plan that they have. So they will be using their cash reserves in water quality. On page 7, the highlights of expenditures. We expect our total expenditures to be $6,295,033, which is just over $833,000 less than what we had this year. So the theme here is we anticipate less revenue coming in, and then we also anticipate quite a bit less in expenses for fiscal year 25. For our FTE, or the level of staffing that we have in the health department, that FTE equals 39.45 FTE. So of course, this is not people. This is how much time people spend doing the work of public health, where one FTE equals a 40-hour work week for a staff person. So we do have staff people that work less than full time. So that's why you see an odd FTE. The staffing changes that we anticipate for fiscal year 25 include an increase by a 0.15 FTE in Water Quality Protection District. This is for outreach and education. We have an existing staff person in the district who will be increasing some hours to do this work as it is outlined in their strategic plan and essentially directed by their board. This FTE also includes a reduction in force. So as you all know, and I've presented several times throughout this fiscal year, is that we've done some restructuring in order to meet budget demands. And so the reduction in force this year resulted in 5.25 FTE. So we lost that many staff, that much FTE to do the work that we do in order to balance the budget. The salaries do reflect regular step increases, longevity, and also a proposed matrix adjustment of 3.5%, which is a cost of living increase. That is an anticipated amount that the Board of County Commission will approve during the budget approval process, but we included it as an expense in our budget, so we will anticipate that will be approved by the commission. Our fixed expenses essentially boil down to personnel and then rent and IT. Those are expenses that we don't have a lot of control over. The county sets the salary for staff, and they also rent and IT. Those amounts are set by other departments within the county. So IT sets the IT expense, and then Public Works sets the expense of what we pay in order to use this building as a county building. So our personnel expenses, we're looking at $3,758,959 for fiscal year 25, which is over $293,000 less than what it was in fiscal year 24. And our fixed expenses, rent and IT, this coming fiscal year, we expect to spend $712,405, which is $204,000 less than what we spent in fiscal year 24. The mill portion of our budget, which is again the property taxes that we collect to do the foundational public health work that we do, that revenue will help to subsidize and match funds required in three of our grants or three of our projects. So the first one is air quality. We've had our air quality program for years and years. That ordinance adopted by the county happened back in 1999. So we've had an air quality program in place for a long time. The state gives us a small amount, about $20,000, just over $20,000 per year to do this work, and they require a match. And so the $23,592 is that required match to those state funds. Licensed establishment, this is a subsidy because we collect fees that are set by the legislature to do the licensed establishment work. So inspections of restaurants and pools and public accommodations and so forth. Those fees only bring in about between $50,000 and $60,000 in revenue per year. So our tax dollars at the local level subsidizes that program in order to do that work. $306,335. So quite a large amount of our local tax dollars go to make sure that we can do that required work. We're required to do it by law. We don't have a choice. We have to do it. It's the right thing to do. It is foundational public health work. And so we subsidize that. And then the maternal child health block grant. This is another grant that requires a match, and that match is 75%, which equals for fiscal year 25 a $46,940 match. So in the budget, those are considered to be expenses to the mill, and then they are transferred over to those grants essentially to show that we've matched the grants that we bring in. Our capital improvement plan expenditures for fiscal year 25, we anticipate purchasing a replacement of our large copier printer fax scanner. It's the big monster machine that does it all. So our capital improvement plan allows us to save up. So we're able to put money away and save up for replacement of large equipment pieces. So we have the money in our capital improvement plan to make a replacement purchase of this big copier for this next year. Similar to Water Quality Protection District, we'll be making a large equipment purchase out of the capital improvement plan as well. Again, funds are saved, and then when we make the purchase, it comes out of those funds that have been saved to make that purchase. We also will be making large deposits into our capital improvement plan to get them back to fully funded. So our mill will contribute $150,000 into our capital improvement plan, and water quality will be contributing over $38,000 into capital improvement. These are larger than normal amounts because we were behind in those funds. So what this does is get our capital improvement fund back to what the county considers to be as fully funded. Next year, we won't see those large amounts being put into our capital improvement fund. On page 8 of your packet, this is a summary of our entire budget. So all three pieces summarized into one summary. And so I'll just bring your attention to essentially two numbers that are important to know. So the very first line is the total revenue. And if you go all the way across to the very last column, it's $6,515,120. That is our anticipated revenue for next year. And then if you go down to the dark orange, that is our total expenses anticipated in our budget. The $6.2 million as an anticipated expenses. So just summarizing again, we have expenses less than what we anticipate getting in as revenue in the health department. On page 9, starts to break down the budget into the 3 pieces that I described to you in the memo. So the first is our mill budget. So again, on this summary sheet, you'll see what we anticipate for our overall mill revenue. So these are, again, our property taxes. All the way over to that last column, we anticipate $2.9 million in revenues. And then the orange represents the $2.7 million in anticipated expenses. The other thing I want to point out to you, if you keep going down to the bottom of that spreadsheet, there are 2 numbers that I want to bring your attention to. So the second to the last column, which is the column that's titled 2023-2024 actuals. If you go down to the row that says ending cash, it's an amount of $639,000. Is everybody tracking there? Okay. That is how much we anticipate having as cash reserves at the end of this fiscal year. And then the amount right under it, the $780,000, that is the amount that we would need to meet the 90-day reserve. So at the end of this fiscal year, we're not quite there, but we're close. We're getting closer. In the next column over, the $1.1 million that you see under ending cash balance for fiscal year 24-25 budget, that amount is what we anticipate at the end in our cash reserves at the end of fiscal year 25. That is a long ways from now. So I wouldn't put a whole lot of, don't put all the eggs in one basket, right? But calculations show that if we spend our budget as anticipated and we get our revenue as anticipated, that our cash reserves will grow over the course of our fiscal year 25 budget. And then the amount right below that, $899,000, shows that that's the amount we need to meet our 90-day reserve. So by the end of fiscal year 25, we will have reached that goal. If we spend as anticipated and if revenue comes in as anticipated. The next several pages are just the detailed breakdown of the mill. So the green represents the detailed breakdown of all the different types of revenue we anticipate coming in to the mill. So these are things like fees for service. When we give a shot, we can collect that revenue back again, either from the individual we gave the shot to or from the insurance company. So those are the types of things that you would see under revenues for the mill. And then again, the orange section of the budget represent all of the details associated with expenses in the mill. Then on page 13, that makes a transition to our grant section of our budget. So this first page is a summary again. We have grant revenues coming in at $1.3 million if you look at that far right column. And then grant expenses coming in at just over $3 million. We have 18 grants again anticipated in this fiscal year. Our grants get approved by commission as they come in. So this is really just FYI. This is the grant revenue we're expecting, and we will spend the grant revenue as those grant contracts tell us to. So there's really no conversation here. We get the money to do the work that we're told to do with the grants. So, but it's nice to have it there for you to see what's happening within our grants. The next couple pages it's just the grant budget breakdown of all of the detail then. The revenue in detail and the expenses in detail. Page 17 starts the Water Quality Protection District budget section. And again, on the far right column, you see they're anticipating revenues of $406,000 and expenses of $497,000. So again, they will be using their cash reserves to balance their budget at $90,000. You can see at the bottom of fiscal year 24 that they will have plenty of cash reserves to pull from. And we're projecting at the end of fiscal year 24 that their cash reserve will be almost $254,000. And a 90-day reserve is $116,000. So they're way over their reserve. And by law, we have to manage that. We can't just have a lot of money sitting there. We need to be using it to do the work. So that's what they're doing. Fiscal year 25, they're using some of that cash reserve, 90,000 of it, to balance their budget and do the work that they need to be doing. You can see projected ending cash balance at the end of fiscal year 25 is $155,000. And the 90-day reserve is $164,000. So we're right about on for water quality at that pace. The next two pages then reflect the details of the water quality budget. So you'll see revenue details and expense details on the next two pages. What questions can I answer for you?
Turn up the heat. Freezing. I know that's not what you expected.
No, we're trying to save money in the health department.
Well, if it's cold here, it's hot over there.
Yeah.
That's how it works in the zone.
Oh, really?
Yeah, the zones are a little wonky. So,
I just,
yeah.
it's livening things up.
Yeah.
It's okay.
Yeah.
Is there, from the previous in April, what are the biggest discrepancies in these three budgets or the whole budget? Is there any discrepancy after the discussion of last April's Board of Health meeting when we first talked
The
about
preliminary budget,
Mhm.
we very little changes. It really just came down to making sure that all the details of the expenses were added. And so very minimal change. If you were to look at your packet from April and then the packet now, very minimal changes occurred. Not substantive. It was really just going through and making sure we didn't miss anything and that we have all the things budgeted that we need to have budgeted.
How about online? Any questions? Any at the table? More questions or discussions? Great. Can I call for a motion to recommend the approval of the fiscal 25 budget?
I'll move to recommend budget be sent to the county commissioners for approval.
Thank you. Can I have a second?
One second.
Excellent. Is there any public comment? Any further vote? Oh, great. Can I call for a vote then? Thanks for turning your camera on there. All of those in favor, say aye. Aye.
Aye.
I will recuse myself because I have to make the final decision on this, so I can't vote.
Thank you.
So let me ask a question. Since Commissioner Payne can't vote, we only have 4. Is that still constitute a quorum?
Yes.
Okay. Just wanted to make sure.
She is, although not voting, she is present. And her being abstaining from the vote is a vote.
Okay.
So
Great, okay. Motion passes. And thank you for that really clear and wonderful presentation.
Yeah.
And Heather, thank you for all your work. I think those changes were really well done.
Yeah.
And it was easier for me to follow from years past, so good job.
I particularly like the part where they parsed out the grants. And that part of last year's budget just had me completely confused. So it really just helped clarify everything, and I really appreciate it.
yeah, the grants are baffling. They're almost 50% of our budget. But when you take them out, you can actually see what is happening in our true mill budget, which is what we are able to see now.
Yeah, good job. All right, well then we're gonna move into our approve updated specimen transport plan, please.
Good afternoon, Madam Chair, members of the board. I'm Laurel Reek, our Environmental Health and Disease Prevention Administrator. And today I have for you our specimen transport plan from our emergency preparedness plans. So I'm going to share my screen. And are you seeing my presentation?
Yes.
Okay, I'm not. So I did something I got to fix. Sorry.
No worries. Take your time.
And Laurel, we're not seeing the presentation version. We're seeing the,
Oh, that's not good.
yeah. So it might be selecting a different screen.
Okay.
That version will work though, so don't battle it.
Sorry, it's on my laptop and it's not allowing me to close that part. I don't know how to do it. So I guess we'll just leave it like this. I'm sorry.
You're okay. We all have it in our packet too.
And you stopped sharing, so can you try share again?
Yes. Let me try again.
There we go. Now you got her.
All right. Excellent. So we are required to review and update our specimen transport plan every year for our public health emergency preparedness grant. And one of the requirements is that we get a signature from our partners at the local emergency planning committee and from the Board of Health. So we're bringing this to you so that you can understand what it is and what resources are available during an emergency. Okay, now why is it doing this? So the purpose of our plan is to provide a rapid assessment and delivery of specimens for laboratory analysis in the event that we have to respond to something that could cause harm to our community. So this could be environmental samples, it could be clinical samples, anything that needs to be analyzed in order to prevent harm to our community. Our situation here is that we're in the state capitol. So the state laboratory is located just down the street from us. So it's not like some of the other counties in the state where they have to travel many, many miles to get to the state laboratory. That makes it much easier. One of the things that does happen when we have something that's a credible threat that we're trying to analyze that solution for, what we're aiming for is making sure that that information can be used for evidence if it ever comes to a trial. So there are chain of custody documents that have to be maintained when we make move samples. There's a whole set of procedures in this document. I think the part that you guys need to know about is that there is a process, and we do everything we can to take the right sample to get it stored properly in the right medium and get it to the lab as quickly as possible. Our lab does have 24/7 access, but you do have to call in advance to make that happen. Otherwise, we won't need anybody there. We do have kits that have those things that we need in them. One of them is our drinking water emergency sampling kit. This is used when we have episodes of potential public water system contamination, and typically we're looking for intentional events. I did ask the state if there were any examples of how this drinking water emergency sampling kit, or DWES kit as they affectionately call it, has been used in the state. And one of the things that they told me is that there was a water resources department that went out to their site on Monday and found that a 40,000 gallon storage tank on a water system had been opened and some debris thrown in, such as rocks, a fence post, a small piece of cement, really good things to have in your drinking water. The operators reported that they had checked this tank on Friday and it was closed at that time. So the tank was not locked, but all the tanks in the water system were subsequently inspected and fitted with locks to protect the system. After this event, approximately 50 homes were visited by operators, and a do not use order was hand delivered to each home, and they were provided with bottled water. By Monday afternoon, an emergency sampling kit was used to collect samples, and those samples were driven to the state lab and arrived at approximately 11 p.m. It was one of those instances where they were a long ways from the lab. They cleaned and disinfected the tank and the distribution system, and the homes were provided with water again. The sampling results showed total coliform bacteria and E. coli were found in the tank chamber that was breached. All other results, then they tested for metals and volatile organic compounds and pesticides. They were all negative, and those physical parameters within normal range. So it was not as bad as it could have been. With follow-up on that community, there were no unusual cases of illness, and follow-up testing showed it to be good and ready to go. So it does work, and we try to make sure that we have these systems staged in different locations around the county. We have 5 kits, and if there's a need for them, we will put them into action. We also have a chemical biological agent transport kit. We call those CBAT kits for short. I did ask the lab too on this one when it might have been used, and they didn't have any examples of use because they hadn't been used correctly at this point. There have been instances when they could have been used, specifically when there were 3 white powder lace letters sent to several state legislators. What these CBAT kits do is protect the person delivering the sample from the agent of concern, as well as the laboratory staff when it's actually delivered. Again, we have 5 of these kits stationed around the county, and we can make use of any and all of them. When you have these kinds of kits, it's also important to maintain them. If you use any of the supplies, they need to be replaced. We have an annual inventory requirement so that we make sure that they are supplied and ready to use when we need them. And they're also sealed. So that means then that the testing supplies are actually protected from contamination. So when we have a result from that sampling event, we know that it was actually an event and not because the bottle was contaminated. I would be happy to answer any questions you have on this.
I just had a quick question, Madam Chair.
Yes, please.
Laurel, when you have to check the kits annually, are you responsible for checking the ones at the other facilities, or is that a shared effort?
That's a shared effort. I send out the information that says what has to be replaced in them. Actually, the state laboratory gives me the things that have to be replaced, and I ship them out to our different places where they have the kits. They have an inventory page that is actually online. They go through it and make sure they have everything that's supposed to be in the kit. And then they email me back and say that they've changed it out. They've inventoried it and they have everything they need.
Thank you.
Great. Thank you, Laura. Does any other board members have any questions? Any discussion on this topic?
Hey, what's up?
Okay, can I have a motion then?
I'll make a motion to approve the updated specimen transport plan.
No, I'm on
Thank
the
you.
what help is on the call right now.
Hey, Wilmot, you're not muted, thank you. And we're about to take a vote, so, can I have any public comment? Okay, hearing none, camera on, if you would, Mayor Collins, if you can hear me. Awesome. All in favor, please say aye.
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 Thank you so much. And it passes. I think I heard everybody say aye.
Yeah, you can always ask any.
Any opposed?
Now
Okay.
you know for
Yeah,
sure.
no, I don't think so. I think I heard everybody. Okay, great. Moving on to the soil displacement regulation revision presentation.
Hi there, Madam Chair, members of
Hi.
the board. Beth Norberg. I am Environmental Program Supervisor in the Environmental Division. And I am here to hopefully briefly discuss an update to our soil displacement regulations for the East Helena Superfund site. That is in your packet. I didn't get a copy of the packet on page 32. Thank you.
Yep.
And there's a reason for this. We do need to update the regulations to match some changes with EPA guidance and standards. So I'll kind of briefly go over this with you. And then what I'll be asking today is to vote to recommend, we'll open the public comment period. Just stop there. Yeah, open the public comment period and go through that process. So this is I think the first regulation maybe that will be shifting to the local governing body. The second? Oh, okay, good. So phew, I'm glad I'm not the poster or the practice child for this. So so on the slides that we have here, I'll give a brief history. First of all, what is a Superfund? I'm sure all of you probably know what a Superfund site is. But just as a reminder, it's under CERCLA, which is the Comprehensive Environmental Response, Compensation, and Liability Act. That is what Superfund is called. And what it does is it allows the EPA, the Environmental Protection Agency, to go in and clean up contaminated sites. It also holds parties responsible for cleanup and to make and also or to reimburse for cleanup. Of course, in the event where there's no viable responsible party, it allows funds for EPA to be able to go in and do that work and clean up the contaminated site. We've had, East Helena, the history of it It was the Asarco lead and zinc smelter. It operated for over 100 years here in East Helena. There was aerial deposition of lead and arsenic and other heavy metals. So as the ore was being smelted, it went up through the stacks, and the wind direction there actually is more kind of a northerly direction, and it went over the town site of East Helena. So what resulted was soil and water contamination. In terms of our timelines, really, they started investigating this potential contamination, looking at blood lead levels in the 60s and 70s. DEQ and DPHHS were doing that, and along with EPA. The smelter was listed on the national priority list, which means listed as a Superfund site in 1984. And then all the residential yards, commercial roads, alleys, all the soil areas in East Helena were started to get cleaned up in the late 90s and early 2000s. And so a lot of that activity happened at that point. Our program came around in the mid 1990s, which was the Lead Education and Abatement Program at that time, or LEAP is what we would commonly refer to it. And then the smelter actually didn't close until 2001. The record of decision came in 2009, which was an EPA document, then the bankruptcy settlement, and then the institutional controls. So if you're wondering what an institutional control is, it's after you've done a lot of that cleanup and remediation, what controls are going to be in place lifelong to make sure that that contaminated site doesn't further contaminate or, cause any further harm, particularly with public health and our environment. So our soils regulations came along a year after in 2013. So this is not a new regulation that we've had. We've had it since 2013 as part of that institutional control. So what LEAP does is we administer and implement the institutional controls that are set forth by the EPA. And that does include this soils ordinance. So one of the things is administering that soils ordinance. We also provide education and outreach. We do investigation of elevated blood lead levels, and with that conduct environmental assessments to look at the source of elevated blood lead level and how to remove it from their environment. And we also provided the public information on cleanup of the site, what soil levels are on someone's property. We get a lot of those calls. Hey, what's my lead level on my property? And we can tell them what that information is. So we house that information in our program. Maybe why you're wondering, what does this matter to us as the Board of Health? Well, here's your authority for that. It's in Title 50. And what it specifically says is local boards of health may propose for adoption to the local governing body regulations for the establishment of institutional controls selected or approved by US EPA under CERCLA. So there are specific guidance for local boards of health to adopt these regulations and for institutional controls. So what the soil displacement regulation, what it generally says, and you all have a copy of it. It's not very big. It's not a big, long regulation, but it was adopted in 2013. What it generally says is permits may be required for the displacement of 1 cubic yard of soil in the IC boundary, the institutional control boundary, the Superfund site. That's about the size of a washing machine or a small pickup load of dirt. And it does require that we certify any person disturbing soil. So we also make sure they're certified in lead safe practices. And it identifies lead and arsenic soil limits for displacement activities. So what are those limits for displacement of soil? That's a general overview of what that regulation says. So why do we have to change it? Why do we need to update it right now? And I don't want to get too far into the weeds of this because it does get a little bit a lot, but it comes down to bioavailability. So last April in April 2023, the EPA went and sampled 50 residential yards in the boundary area. And what they were looking for is actually how bioavailable is the lead in East Helena, meaning all lead is not created equal. It's not all the same. You ingest lead and it's absorbed by the body the same. So this lead from East Helena is a little specific because it was smelted, and it's that fine particle lead, dust, and arsenic. And so they really wanted to know kind of how available it is, bioavailability of it. And what they used is an IUEBK model. It's kind of a newer model to look at that. And what they found is, and this was EPA, they found that between 52.5% and 85% of lead in East Helena is bioavailable, meaning it's readily absorbed into the bloodstream. And when we readily absorb it into the bloodstream, that's where we get health effects. That's where we start to see those things happen. The mean average was 64%. So what they did with that information created a new explanation of significant difference. The EPA likes to use those big terms, but what that did is it identified a lower cleanup level from our current 1,000 parts per million lead in soil to 400. So quite a significant change from our current. If you have a property in East Helena and you're going to be 1,000 parts per million or higher, you get your yard cleaned up. It actually lowered it down to 400. So that was in January. So what we had to do is go and take our regulation and update all of those numbers because EPA now has changed their cleanup level. And they're going to be starting here June 3rd with cleanup of priority areas. So this is where we really needed to get our regulation updated to match their standards now. So what are the primary changes in the regulation? What it did is it changed the requirement to obtain a soil displacement permit from 500 parts per million lead in soil to 400 for residential yards. So this is not commercial or recreational or anything. So for residential, 500 to 400. And you'll see throughout the regulation that number is marked out and 400 is put in there. And that's to match that explanation of significant difference the EPA came out with in January. And lowering the level to 400 parts per million. So now if anyone's going to displace more than 1 cubic yard and they're going to be higher than 500 parts per million lead in soil on that site, they have to get a permit. It also changed the replacement soil requirements from 100 parts per million to 50. And that is in section, you have it 2.5.3. Replacement soil. So when you replace that contaminated soil, you take it out and you need to put new soil in. It has to be below 50 parts per million lead soil.
What do you do with the stuff you took out?
Yeah, so there's a repository in East Helena that is specifically for that contaminated soil. Yeah, we have a dump site, if you will, repository site. And so now that's going to lower down to 50. That is matching a level set by DEQ. And EPA has also requested that number be 50. There's no change in arsenic to that replacement. Typically, when you're cleaning up lead, you're also cleaning up arsenic. So there's no need to change that number. And then we are changing the cleanup action level because of that explanation of significant difference. We're changing lead cleanup action level from that 1,000 parts per million all the way down to 400 parts per million. And that is in section 2.6. And that will be for residential properties, roads, alleys, and railroad right-of-ways, drainages, floodplains, and irrigation ditches. And there's a chart there in table 2.2 that goes through what those cleanup levels are going to be. And we did have the EPA review that table and make sure that those were all updated as they needed to be. And then we updated just some definitions. There were 2 definitions. We had to update the explanation of significant differences because it was a new document. And we had to update the definition to a qualified residential yard. And I think, so then with that, what I'm requesting, like I said in the beginning, is to open a 30-day public comment period. And then we would hold a public hearing at the next Board of Health meeting in June. And that's when we would request the Board of Health vote to recommend for approval to the local governing body, changes to the regulation. And then we would leave it up to the local governing body to approve or deny what not those regulations. So yeah, fast and furious, but questions.
Is the local governing body the East Helena governmental unit, or is it the county?
Yeah, I'm trying to go for it. She knows who they are.
It is the local governing body that was created because of HB 22 in the legislative session. You're a part of the local governing body, so is Commissioner Rolfe. from the county. From the city, it's Mayor Collins and City Commissioner Shurtleff, and then Mayor Collins from East Helena. Those 5 elected officials make up our local governing body that is required to approve any regulation that the Board of Health proposes by law. That law changed in to the 2021 legislative session.
I have a couple of questions.
Yeah.
Was it surprising to you all to get that data back?
Yes.
Yeah.
Yeah, it was interesting. I know Bridget Williams, who's a remedial project manager for the EPA, led that effort. And it was because there was suspicion. There was suspicion that, we think using this new model that we really need we do need to look at what's bioavailable. We need to know how the body's absorbing the lead in East Helena. And so I think they had a feeling that it was going to be lower now. But 400 parts per million was quite a significant change.
With the slack pile, people moving it around now, is there a chance that there's more metals getting dispersed through the air?
So with the slag pile, no, it's very heavy. There's not displacement through the air of dust or anything with that slag. That's how it was, I guess, explained to me actually just a couple of weeks ago. There was a similar public comment at a meeting we were at about that. And they do still do dust depression and things like that. So what they're doing with the slag right now, that's on the RCRA site. That's still under the Montana Environmental Trust Group. And that's the plant site. So CERCLA and what I'm discussing is everything on the non-RCRA site, the non-plant site. So this area of East Helena and that institutional control boundary. Right now, what they are doing, if anyone isn't aware, is they are taking that slag, they're putting it on a conveyor onto train cars, and they're shipping it to South Korea to be resourced. Then they're going to get it down to, I think, the unfumed portion, and they're going to cap it and leave it in place. And then they also have other controls in place for groundwater contamination, because we do have the groundwater plumes. So that there's a evapotranspirative cover that's helping with groundwater contamination. Removing that slag and capping should help those plumes continue to recede like they are doing right now.
Okay,
So
great, thank you. And I have another question.
Yeah.
So if I'm a homeowner in East Helena and I want to rip out all my sod
Right.
and put in rocks or something, and it's going to take a couple trucks full.
Yeah.
So that means that, tell me the process.
So we try to make it honestly as painless as humanly possible. But what they would do typically, usually they'll call for a 811, like a dig locate. We'll get a lot of notification through locate services, or they'll call us. So this is what I want to do. If yes, you're going to disturb more than that 1 cubic yard, then we want to know who's doing the work. And whoever's doing the work, we set them up. It's a 15-minute certification. We can come to them. A lot of times with the industry folks, we go to their office and train all of their people working all the heavy equipment. We talk about lead safe practices, not taking it home to their family. That's a big one. And then we certify them for a 2-year period of time so they can do work. So that's even the homeowner. So even if the homeowner is doing it, we're going to certify the homeowner. If they're the one with the shovel or they want to rent the equipment at Power Townsend, we're going to certify them.
Okay.
And then they're going to get their permit. They fill out a permit request. We're going to review the work they're doing, and we're going to issue that permit to them. We're then going to go and inspect,
At a charge?
typically a pre and post inspection, and there's no charge in any of this. So the certification is free, the permit is free.
Cool.
It really is just part of that institutional control to make sure that we're moving soil safely. And so not interested in a revenue source.
Yeah, totally. Okay. And then you come out and test it?
Yeah, we'll come out and do an inspection to make sure that they disturb the soil in accordance with what their permit said in terms of amount. Making sure that if they moved the soil off-site, it goes to the repository, that we don't want the soil going to their friend's garden in town. That's a huge control, issue for us to make sure that soil goes to the repository. If they're just displacing it and putting it back in place, they still may need a permit for that. And we would first look, let me back up. when that person calls and says, I want to rip out my yard, we're going to look at their soil data. And if it is below 400 parts per million, they don't need a permit for that. We say, go forth, be happy. You know, thank you for
Big away.
us. Yeah, yeah.
Okay,
But if
thank
it's
you.
above 400, we're gonna do the.
It's nice to hear how it will look in real.
Yeah.
Yeah. Any other questions or comment by the board, discussions? All right. In that case, let's see, I would like to ask for a motion to open the public comment period to begin May 23rd, 2024 and end at the next Board of Health meeting on June 27th, 2024. May I have a motion?
So moved.
Thank you. And a second, please.
Second.
Wonderful. Any further board discussion? Okay, let's take a vote. All in favor, say aye.
Aye.
Any opposed? All right, motion passes. Do you want me to read this? Okay, so public comment will be accepted in the following ways. We will accept either written and either mailed off comments dropped off here at the Health Department, 1939th Avenue. Attention soil displacement regulation public comment to Laurel Reek. Or you can email Laurel Reek at lriek@lccountymt.gov or verbally by calling Laurel at 406-457-8914. And then public comment will also be taken at our next Board of Health meeting on June 27th, 2024. Members of the public are welcome to come in person to 1939th Avenue South, Helena, Montana, in the Public Health Conference Room at 1 p.m. or attend virtually using the posted Zoom link found on the Public Health website. Okay. Thank you very much. Next, we will move into our board discussion with our health officer annual appraisal reminder. So you all probably have received at least 1 to 10 emails from Trackstar by now. I myself completed mine today and it took no more than 10 minutes or less. So please make sure to give our fearless leader here your feedback. And it's due by June 11th, I believe. So
we have some.
We have some time, but please don't delay and let's get her done.
Another meeting we have to be at 2:15. So
Okay.
I'm sorry, but my life.
You have the budget hearing next week.
All right. Way more fun than last year.
How things are.
Well, it will be because the grant part and all the state craziness has now been adequately explained. So thank you.
Thank you.
It's nice seeing you all.
Goodbye.
Good afternoon.
Okay. Brenda, would you like to give your announcements on Casper?
Yes, so last month I mentioned that we are doing a health assessment. It's a door-to-door health assessment. And that's happening on June 25th. And we're still looking for volunteers. Last I checked, we were just about 20 and we need 60. So saying again to Board of Health, if you all are interested at all in participating in a opportunity to go door to door and visit with our residents of this county, we would love to have you as a volunteer. I'll resend the link to fill out the form if you're interested. But just as a reminder, we are looking for volunteers. And if you are a part of agencies who you could pass the message and encourage volunteerism within your organizations, that would be extremely helpful.
Yeah, send a little blurb.
Yeah. And then the next item for announcement is our reaccreditation announcement, which I emailed to the board yesterday afternoon. But if you haven't had an opportunity yet to check your email, we were given the earned. Thank you. The Public Health Accreditation Board made a decision to give us our continued status of accreditation for the next 5 years. So we earned reaccreditation.
Very cool.
It was a very lengthy process. We worked on it for more than a year, probably close to a year and a half. And it was many, many steps that we had to go through to get to the point that we earned that reaccreditation. I think the three of you participated in the site visit with our site visitors. So thank you for being a part of the process with us. And that was great news to come into the health department yesterday. So
Yay,
That's awesome.
good job.
we will do a public announcement. We'll work on just publicly announcing our reaccreditation status, and then also a celebration. We'll probably do a celebration after Casper to celebrate both the health assessment, completion of the health assessment, and celebration of accreditation at the same time. So we'll look for something in the summer in a park somewhere with some
Lovely.
sunshine. Dr. Padella,
Or snow.
I'm ordering sunshine from you now. Maybe you can make that happen between now and July. So. Great.
Okay. Moving on to our next agenda item, board training, return on investment for public health.
Yeah. Thank you, Madam Chair and members of the board that are here in the room. So I didn't send materials in advance. My hope was to give you a little bit of information, and then our chair was going to prompt discussion. I can certainly send this out to the full board, though, to give them the same information that you all are going to hear from me today. But I think that it was Dr. Bedell, actually, that after the last meeting, and I think in connection with our budget discussions,
Yes.
how important it is to not only think about the Board of Health budget in a silo, but really, what is it that we are investing in? And what are we getting in return with the money that we're putting into public health? And so I took that prompt from Dr. Bedell, and I did some research. You know it in your gut when you work in public health, the impacts that we have, but to actually pull that data and to do that research was pretty empowering. It really did and should help us all kind of stand up a little straighter and be proud of the work that public health does, because it has an enormous impact on individuals' health in our communities. So Benjamin Franklin, very well-known quote, "An ounce of prevention is worth a pound of cure." And so these numbers that I'm going to be sharing with you is proof of that. So
And I want to just interject really quick and say that I really appreciate that you made this, and I feel like this would be so good to have more board members. So if you want the permission or whatever it would be to put this on the next, and so it can reach more of us, because or you can just carry on if you have a packed training, but I know that you put a lot of work into it, and if you'd like to put it on the next agenda.
It's just us three.
Because it's just us three,
Yep.
and I feel like
I'm speaking to the choir.
I feel like this could really benefit some of the people less familiar with public health, and if it makes sense and you agree, we could postpone it for the next board meeting.
I'd be happy to.
I think it'd be good to send it out prior, like, I don't know. Yeah, because I think it'd be impactful, like you're saying, Madam Chair, of like hearing it in person, because I think it might get lost in emails prior to that.
Yeah.
I think it's.
I'll put it in the board packet. And I think that the power behind the information I was going to share really would come from the discussion that the board would have based on the information I was going to share. So, and what's actionable. I mean, it's really great to share that, doing some tobacco prevention work or our childhood vaccination work really does have a monetary return. But what does that mean for our community? What does that mean for our county? And what can the Board of Health do with that information moving forward? And that discussion is really where the power is, I think. So I'd be happy to. I didn't have any plans for June for a board training, so it would be easy to move this to the June agenda.
Well, and I honestly, like, our elected officials need to hear it, right? 'Cause
That's
we
what
have
I was
three
thinking.
that sit on
Mhm.
this governing board, but then three that make the ultimate decision
Mhm.
that need to hear it.
Mhm.
Agreed.
And I might just, in my budget presentation next Thursday to the Board of County
Great.
Commission, may take parts and pieces of this as my introduction.
Oh, I love that idea.
So
I
that
would
way
be-
all three commissioners can hear it. Since they are the ones that have the authority to adopt the budget,
Mhm.
to include some of this information in the budget hearing might be a really nice way to set the stage for the budget.
Be excellent.
I think that's a wonderful idea. It actually puts the numbers to the purpose,
Yeah.
and that's what they need to hear the most, I
Yeah.
think. So, for sure.
Will not be lost, the time spent. So
No.
I'll use it next week and and then we can do it again
Well,
in
and
June.
it's money well spent.
Yeah.
Yeah, and if,
When it goes into the budget.
yeah, and if Commissioner Payne has heard it once, when she hears it again, maybe even it'll help generate some more really good discussion
Mhm.
amongst some people with less health experience. So. Mhm.
Thank you.
I think it's neat to see your excitement and
Yeah.
like just being reminded how like how much return on investment there is, you know, to the health and well-being of people and then also the fiscal side of things. So
Mhm.
Mhm.
I like seeing that
Yeah,
enthusiasm pop right out.
it sparks
So,
again.
yeah.
Yeah. Yeah, sometimes we just, heads down and we're just grinding through, right? We're just doing the work. We know that the work is good work. And we know that we're having an impact, but to actually have the data to show that we're having an impact
Mhm.
really does help to keep us all motivated. And I think that it's really, it is important information for policymakers to understand.
Mhm.
So moving into the legislative session, moving into our budget hearing, all policymakers do need to hear and understand, the impact that we have and why investing in public health is so
Mhm.
important.
Mhm.
Yeah.
Well, and I just think even just that presentation from Beth, I mean, some people get really kind of annoyed by, I need a permit to dig up my yard, that kind of thing. But when you really understand why, it challenges some assumptions that, oh, it's just, dirt can have toxins in it. And that's important. It's just so wonderful that there's a program that's watching out for everybody. And they wouldn't even know them. So it's just one of those little tiny things, but
Yeah.
that was a really interesting presentation.
Mhm.
The wizard behind the curtain.
Right.
And no, it's like, they don't understand how it's also driven by the EAP, right? That's, they said this, so now you have to change this.
Yeah.
And if you don't, then it's kind of
Right.
it'll be
Mhm.
difficult to manage, so.
Yeah, and the EAP gives us an enormous amount of money to do that work, which is why we don't have to charge for permits.
That's great.
And so we're able to serve the East Helena community because of the Superfund. It's a designated Superfund site, and EPA funds cover all of the
Mhm.
work that happens out there. So
And part of that, then I forgot, I couldn't articulate, but is part of that just, is the EAP looking at how much soil is going to be moved around there in the next 5 years? Because that is the biggest development site
yes.
in this county going.
I think
growth is
that
there.
a lot of the study that happened was prompted because of the development that is happening.
Okay.
Mhm. And the redevelopment.
Yeah,
So a lot of the area that is not yet developed will be developed in the next couple of years. And so that prompted the study and a better understanding. So, Yep. And that's what we do. It's a
Mhm.
science. And so we're always learning and then adjusting,
Mhm.
learning and adjusting. That's what public health does.
And what kind of outreach for public comment is planned?
For the regulation, so we will post on our social media that the public comment period is open. And then we need to put it in the IR as an ad.
Great.
how does that work with the IR and all your state papers? I'm literally running every 3 days now.
Yeah, it gets printed and then it's on an online ad. It's considered a legal ad.
So it's not affect since doesn't affect it since the paper only runs certain days or updates.
As far as getting it in there, no, but the viewership is way low.
Right.
So It is just one of the ways that we can get the word out. Social media is probably a better, more effective way of getting the word out that we are accepting public comment. So, yep,
I'll be interested to see what the public comment is from that,
yeah. Yeah.
from that constituent out there. Yeah.
Yeah. Well, I think that was the end of the agenda then.
It is, okay, well. Any public comment?
There is none.
Thank you, Jolene. Then we will adjourn.
All right. Let me see. All right, we'll see everybody in June.
Thank you.
For my final.
Should we have a cake?
Nope,
Yeah.
no, nothing, no.